One of the most common questions that I'll get in my practice is, what are the most common side effects of liposuction? And really, the most common side effects are bruising, which is completely normal and will typically resolve within the first week after surgery. Swelling, which is completely expected, and that's the reason why I highly recommend compression garments and starting post-operative massages. And then, of course, the other most common is pain. And what we do in the operating room is we use certain techniques and medications to try to lessen that pain when the patient wakes up. And of course, I always send pain medications to the patient's pharmacy prior to surgery so that they can have it readily available when they get home. Swelling, bruising, and pain can last for sometimes a week after surgery for pain, sometimes a couple days after surgery. It really depends on the individual patient. I usually tell them the first couple days after surgery are the most uncomfortable, but once they hit that 1 week mark, they really start to feel a lot better from a pain perspective. Bruising, kind of the same thing. Sometimes some patients bruise really well, where after surgery they're very mild bruising. Others tend to bruise a little more. So same thing there. I would say at a week, the bruising starts to get a lot better. At about 2 to 3 weeks, it's greatly improved. And swelling is really one of the most common side effects after liposuction. That can last for weeks or even months, and that's why it's really critical to continue to wear your compression garment and continue to attend your post-operative massages, that are recommended by your plastic surgeon. Can I gain weight after liposuction surgery? And the answer to that is definitely 100% yes. That's why it's really important prior to undergoing any body contouring surgery, such as liposuction, that you're really mentally and physically ready with your lifestyle prior to undergoing surgery. And the reason for that is it's going to give you best results over a long period of time. Patients, after you undergo liposuction surgery, if you're already eating healthy, you're exercising, you're at your kind of target weight, but there's really just some stubborn areas of fat that you can't get rid of, then you're a perfect candidate for liposuction surgery. But if you're kind of not eating healthy, you're not leading a healthy lifestyle, you undergo body contouring surgery, there's always a great chance that you're gonna gain weight, or you can even lose a lot of weight, and either of the two can compromise your results in the long run. Some of the most common complications after performing liposuction surgery are really pain, which is controlled with medications and typically is much improved after the first couple days or the first week of surgery. But really the other two biggest complications, or really expected outcomes, are swelling and bruising, and those are greatly decreased with compression garments as well as post-operative massages. Just like any other surgical procedure, there's always other potential risks like bleedings or infection. But if you go to a trained plastic surgeon who performs these procedures regularly, the risks are very low. And that's why I always tell patients it's really important to do your research and go to a trained plastic surgeon for any plastic surgery procedure. One of the most common questions I'll get from patients prior to undergoing liposuction surgery is, what can I expect immediately after surgery? What am I going to feel like? And the most common things that a patient's going to feel is definitely some soreness the first couple days or even the first week after surgery, bruising, that's completely normal, and swelling. And these are probably the three most common expected outcomes after liposuction surgery. But typically with pain medication, sticking to your compression garment as recommended by your plastic surgeon, and sticking to post-operative massages as also recommended by your plastic surgeon, they'll be greatly improved within the first couple weeks of surgery, and patients will typically do very well. So recently I had a patient who underwent liposuction surgery. The patient was a female in her 40s, and her recovery went pretty great. The first couple days she was sore. If you perform liposuction kind of in the wrong layers or just under the skin, or somebody who's not well trained in liposuction, it can really create some skin irregularities and some scarring underneath that's then very difficult to fix, if even possible at all. So that's why I always recommend go to a trained plastic surgeon who knows the correct technique of where and how to perform liposuction.